So as the COVID-19 vaccine rollout continues for the initial group, which are healthcare workers, so do the conspiracy theories. And it's not only happening in South Africa, but it's happening abroad as well. The United States has partnered with South African experts to conduct research and give advice on many issues, saying there has been pushback in the vaccine narrative, and this may be harmful, especially in trying to track COVID cases and prevent people from becoming infected. So to discuss this, we are joined by the Health Attaché at the US Embassy in South Africa, Dr. Sophia Siddiqui, together with Professor Glenda Gray, who, of course, is the President and CEO of the South African Medical Research Council. Ladies, what a pleasure to have you. Thanks for joining us.
Good morning. Good morning to the listeners and the viewers.
Absolute pleasure. Looking forward to this conversation. So, Dr. Siddiqui, let's perhaps begin with you. Please tell us a little bit more about your role at the US Embassy and how this relates to your work in South Africa.
Well, good morning, Leanne, and thank you very much for having me. I serve here and represent our Department of Health and Human Services, which is our premier agency for the health of all Americans and engages globally in our health programs. So I represent them here and work very closely with our counterparts here to see how we can work to advance the priorities of both countries in public health.
Which is so important, because I mean, now where South Africa is trying to get into the swing of things, to say we've seen the US, you're well on your way. I mean, as it stands, the last amount I read was that there are about 50 million doses of the vaccine that have been administered to American citizens. Here in South Africa, obviously, it's a much smaller scale. We've just started this whole rollout, but from the US perspective, how has it been?
You know, I think this is a challenge of a scale that we have not seen before, and we've not experienced rolling out this many different types of vaccines with different dosing schedules all at the same time to an entire population. So I can say that wherever each country is in their rollout, this is going to be a challenge for everyone, each one of us. And I think we're going to learn from each other as we move forward.
Yeah. All right, let's start to the South African perspective now. And I mean, it's been quite heartening to see that ours officially is underway, Professor Gray, and we can see that this Johnson & Johnson vaccine that obviously has been administered to, I'm not sure what the updated figure is, but I think as of yesterday it was, you know, well into the 60,000s. I don't know if we've hit 70,000 already, but we've started and we're gaining momentum. Obviously, these are for the frontline workers, but up till now, how would you say the process has gone?
I think we have, first of all, a lot to learn, and we are over 70,000 now. And I also need to mention that the whole ensemble study would not have been possible if it had not been for the collaboration of J&J with Operation Warp Speed and BARDA. And so we were definitely the beneficiaries of collaboration with the US government. And even as we roll out our program, is that we need and require the collaboration of the US government to assist us in trying to unlock the bottlenecks that we have. So I think knowing how they managed, learning from them, hearing about their challenges, I think it's very important. I think we're already facing some of the challenges that the US had, and that is obviously around making sure you select the right people at the right time for these precious commodities. So at this moment in time, over 70,000 health workers are receiving this, and these vaccines are coming in on a weekly basis, and we are dispersing them as rapidly as possible to all corners of the country. And so learning from the scheduling system, learning from the electronic vaccine data systems, the systems that the US uses, and some of the challenges that you face towards the end of the day. I know in the US, when it gets to the end of the day and there's spare vials and doses available, and SMS goes out and people rush to the vaccine site and to receive the vaccine. And I think we want to learn how they do that, and so that no vaccine gets wasted, particularly towards the end of the day when there may be excess doses available. So I think we have to learn about that. We have to learn about the side effects the reactogenicity. Obviously, healthcare workers have been exposed to COVID far more often than anyone else in this country. And so we do expect much more reactogenicity and more side effects because of the exposure to COVID in the past.
Yeah. Let's talk side effects. Obviously, Dr. Siddiqui, the US have been administering the vaccines for a slightly longer period. You've used, obviously, I think it's the Moderna vaccine. I don't know if it's Pfizer or is it AstraZeneca. I'm not sure which one. It's Pfizer, correct? And now Johnson & Johnson. Okay, so
yes.
Both. And the AstraZeneca, the Johnson & Johnson has just got approval as well. Let's talk to side effects. What has predominantly been reported in terms of side effects?
So, at this time, Leanne, over 65 million Americans have been vaccinated. And our Centers for Disease Control has been keeping a very close eye on side effects. And for the most part, what we've seen are what are the regular side effects of vaccines when people get some, fatigue, or they get stiffness and soreness and those common things that most people experience as side effects. What we're seeing from the point of view of severe side effects is that at this time it's hovering somewhere around 4.5 out of a million doses administered, which is, consistent with what we've seen in other vaccines, and the data continues to come in every day and get looked at. So this is a very carefully monitored process, but we really haven't seen many safety signals at this time that really concern us.
Yeah. What about the infection rate? I'm trying to look at it. It's amazing how the data was a lot more effective in the earlier days, but now that the vaccines are coming in, I suppose the data is not as effective and maybe not as much as it used to be in terms of that fast and counting and knowing. But what are we looking like in the US in terms of the infection rate? Has there been a dramatic drop since the vaccines have been given? Or is it still up there? Because obviously you've got to roll out to the majority of the population to get that herd immunity, to actually see it taking effect. But what are the stats looking like?
Yeah, so you're very right. While cases have come down a little bit and we're looking at, slightly better numbers, what has been noted recently as yesterday is a plateau that we're hitting of about 70,000 a day, which is not where we want to be, because that's what's happened before to us. When you hit that plateau, you worry that it may go up again. And that is where our concern lies. And while the vaccines are being rolled out, immunity is not immediate. We know that, and we know that we're going to have to push for all the measures that we have been pushing for the last year, and it's getting harder because people are getting COVID fatigue. But really, it's very important now for us, especially as we roll out vaccines, to pay even more attention to these measures and try to bring ourselves down even more so that we get out of that unsafe zone where we could strike back up again.
Yeah.
So definitely a concerning moment for us.
So, Professor Gray, let's come to South Africa and to the South African message. We heard the president addressing the nation at the beginning of the week, and level 1 is where we're at. We're basically getting life back to normal. This is an economic decision, we know this, but it also is a decision on the back of cases have gone down. Today, reporting, I think, about 566 cases in the last 24 hours. We haven't seen numbers like this in a while. It has dropped substantially. However, the virus has gone nowhere, and there are great fears of a third wave. So let's talk about that, because obviously what we saw happening in South Africa in December, we certainly don't want to see happening again as we start turning into the Easter periods. But what are your views on now opening up completely and worrying that we are nowhere yet with the vaccination and the numbers of people that we want to see vaccinated?
I think it's great that our numbers are coming down, but this doesn't mean we must let our guard down. And we still need to be very vigilant and practice our non-pharmaceutical interventions like mask wearing, social distancing, and hand washing, avoiding crowds, and making sure that we're not in any super spreading events. We do expect, as winter comes, to have a third wave. That's exactly what happened in the Northern Hemisphere over winter. And we should also be prepared to be nimble and accept going up and down levels of restriction. And so, like we saw in Europe, and like we've seen with curfews being implemented and then lifted. So I think we have to be nimble and realize that until we've got control of the virus, we're going to have to adjust the way we live and make sure that we can try and contain and control transmission. So as long as there is transmission that's ongoing, and as long as there are cases in South Africa, there will be onward transmission. And so we can expect, until we control this virus, that we will continue to have minor outbreaks, super spreading events that cause outbreaks in certain populations. And then when winter comes, a third wave. Hopefully by the time the third wave comes, we've managed to start vaccinating or completed our vaccination of the healthcare workers and have got to some of the elderly people with comorbidities. And this is where we're going to have to learn from the US. How do you move out from your healthcare workers, which are relatively well-defined and easy to find, to a more generalized population? And how do you execute that rollout when you're starting to look at the normal population outside healthcare workers?
Yeah. Let's talk about variants, though, because obviously we know that in South Africa, the discovery of the SARS variant that was here is a big one. Now, this was a big problem when it came to the vaccines and the rollout of the vaccine, which was a little bit of a hiccup. Then Johnson & Johnson was seen to be having the highest efficacy against this variant. Obviously, globally, there are a lot of variants. This virus is mutating, and there's a great worry. So where does that leave us? We see the US having, 65 million plus vaccines given. Here in South Africa, we're sitting at the 70,000 mark. But the worry of variants and how effective these vaccines are, if this does mutate even further, what then? Perhaps, Prof, let's begin with you.
So we do expect the virus to evolve. The virus, there's always a natural war between the host, the human, and its immune system and the virus. And eventually one or the other changes and wins. And so we have seen viral escape, and we expect to continue to see it. And even with vaccine development, we expect that at some stage or the other, the virus will escape the vaccine-induced immune response. And it's important for us to keep ahead of the game. And so while we have to continue to monitor breakthrough infections, we need to continue to make sure that we are looking at the whole genome sequencing of the viruses, like we did in South Africa, so we could identify the new variant and continue to do this. And so we have to get ahead of the game. Already, as we speak, Pfizer, Moderna, and J&J are looking at the variant and are adjusting their production and manufacturing to take into account the 501Y-V2 mutation in South Africa. Yeah. So we can expect towards the end of the year new vaccines coming on board that will have been modified to make sure that it can act against the local variants. And this will happen year after year. As the virus evolves, we will have to adjust our vaccines to make sure that we include the variants so that we don't have issues with viral escape. And so, we will be in a position where we will probably have to have vaccines on a regular basis if the variant if the virus is evolving faster than the vaccine can manage it.
Yeah. So what does that mean in terms of vaccines? How many times will we have to be vaccinated? Is it an annual vaccine that all of us will have to get?
Well, we're not sure yet, but I think we should expect that is what's going to happen. It is possible that there's cross protection, and that the vaccines that we have developed can have some kind of impact. If not, we will have to adapt to it. So I think we should be open to the fact that we may need to have, we might have to have variable or booster doses to take into account the variant that's circulating at that time. And so it may be that this becomes like the flu vaccine, an annual occurrence.
Yeah. I mean, Dr. Siddiqui, I'm reading here that the first case of what was detected in South Africa, that variant has been now found in Florida, as well as the UK variant also, and the Brazil variant that has been found, all now moving into the US. Is there a great worry that although the vaccine rollout has been massive in the US, this is still the generation 1 vaccines before these new variants were found? Is that a worry to the US health system?
So definitely, viruses do not respect boundaries or geographic limitations. And we expect that if they are in one part of the world, we can almost already assume that they are, if not already present, going to be in other parts of the world. I think, as Professor Gray was just pointing out, our hope is to get ahead of the virus. I think we're very lucky that at this point we have several vaccines that actually show us that they protect severe illness and hospitalization. That's one of the biggest challenges we've had with COVID. We've lost too many precious lives. So that at least is a good thing, even in the face of these variants. I think what we're really trying, and I think everyone in the world is trying, is to be able to contain the virus either through vaccinations or through these non-medical measures, so that we get to a place where we prevent it from, one, infecting the vulnerable, but more importantly, infecting people in general, because that is what gives us the opportunity to change and mutate and cause new variants to occur. So I think our goal as a global community is to try to get ahead with the vaccines and the preventive measures.
Just a quick one. We're running out of time, but I think what's important to also talk, while I've got you, Dr. Siddiqui, the criticism that is leveled at the wealthier nations for hoarding all of the vaccines. Our president, Cyril Ramaphosa, has been very vocal about this. How does that sit with the US? Do the US actually care? Or is it a matter of, let's vaccinate our people first, then we'll worry about the rest of the world?
So I think, Leanne, the US has been a global partner throughout this pandemic, even as we were trying to deal with the challenges at home. I can definitely say to you that this pandemic has made it very clear that no country can do this alone. We have to do it together, and no one country can become safe alone. We're going to have to create a safer world. I think President Biden, on the first day he came into office, reaffirmed our commitment to stay with the WHO and to strengthen the organization. And he already recently announced not just that we would be part of COVAX, but $4 billion for the COVAX facility for advanced market commitment and for access to low and middle income economies. So I think we are very much on board that we're going to have to work together and make vaccines accessible all over the world to get ourselves through this pandemic. Yeah. We're in it together, and we have to get through it together.
All right, Prof. Gray, just a final closing note from you as well. I know that the third wave is a big worry. We know that we're only going to be moving at the pace we are moving, obviously maybe a little bit faster as we move into these winter months. But there have been reports that this third wave could be more detrimental to South Africa than we even saw the second wave. Are you in that school of thought?
Well, I think we had to be prepared for the worst, and whatever happens downward is, if something less than worse happens, then we should be grateful. Yeah. So I think we must always prepare for the worst and then be grateful for what happens next. And I think we should prepare for a third wave, and we should be ready for it. We can't be in positions where we run out of oxygen or our healthcare workers are fatigued or don't have enough PPE. Yeah. So let's plan, and until then, let's try and make sure that we protect everybody, including our elderly and people with comorbidities. This has been a devastating epidemic for everybody.
And people that are nervous to have this vaccine, in 30 seconds, is there fear warranted? Because people are very concerned that this might not be the right way to go to get vaccinated, rather deal with the virus as opposed to being vaccinated.
I think there's great complications. We're hearing about long COVID and huge complications with COVID. And also that you also don't know what will happen. You may die or you may be hospitalized. And so a vaccine has been shown to prevent death and hospitalization and severe and critical COVID. And so I would encourage people to get the jab when it's available.
All right, we'll leave it there. Ladies, thank you, both of you. Health Attaché at the US Embassy, Dr. Sophia Siddiqui, and Professor Glenda Gray from the South African Medical Research Council. Thanks for your time. That's where we leave it for this morning. Thanks for watching.